Welcome, Dora, to the practice. We're glad you're here.
Thank you.
You've come today to see me about some concerns you have with your face.
I do, yeah.
So why don't you go ahead and let me know what your concerns are, and then my goal is to really give you kind of a personalized evaluation and an approach. There's not, one correct answer when dealing with any patient's concerns. I want to create an overall plan that allows you to feel confident that you're going to feel the way you want about your rejuvenation, but balance that with the amount of recovery, the amount of downtime, and of course, it's all about safety.
Right.
And again, when we approach facial rejuvenation, I approach it surgically. I approach it non-surgically with looking at skin care, and I have a team of estheticians that will look at you and evaluate your skin. And then we also use a variety of non-surgical treatments such as Botox, fillers such as Juvederm and Radiesse and Sculptra to deal with the face non-surgically. So just as a preface, I want to let you know that I want to give you a full evaluation, but
okay.
Talk to you about on those different levels.
Mm-hmm. Okay. Well, probably the things that bother me the most are obviously the wrinkles around my eyes and a little bit a loss of the firmness in here.
Okay.
And then I notice, my eyes in here a little bit, but I think that's maybe just, I don't know, just
okay.
Those are just the basic things that kind of
okay.
bother me.
Well, what I see when I'm looking at your face is some very typical, early signs of aging, and that simply is that, things that typically happen as we age, especially living in Arizona with the sun, is the fine lines start to come, and those lines can come around the orbital or the eye area. These are called crow's feet. We get some fine lines in the forehead, and those lines I typically would treat with Botox, and that's a fantastic non-surgical treatment. Usually lasts 4 to 6 months and can allow those lines to soften and dissipate. And typically when we treat these fine lines around the eyes, we actually do it in a way not to paralyze the face, but to actually lift the brow. You may have heard of the Botox brow lift, and that's basically a procedure where we use Botox in differential positions around the brow to preferentially elevate the brow while diminishing fine lines. Some of the areas that you have fine lines around your mouth and some of that hollowing, we would use Juvederm or one of these fillers to add volume and to plump up those fine lines. And so I think you're a good candidate for some of our non-surgical treatments, Botox primarily, and then some of our fillers to add volume to your nasolabial folds, which is the smile line.
Right.
We were talking a little bit earlier prior about some of the volume in the cheek areas, and one of the things that happens with age is we lose volume in our face and we become a little hollow, and so adding volume either with some of these fillers or oftentimes with fat grafting, we can take some fat from another part of your body and we can actually sculpt the face with that fat, and that's a permanent filler, but it's your own filler.
Right.
And so adding volume back to an area that's been depleted is a way to add a natural improvement to your face. And then from a surgical standpoint, I think that you're a good candidate for what we call a blepharoplasty, which is eyelid lift, and that would be a way to remove some of the redundant skin in your upper eyelids and your lower eyelids as well. I don't think you're ready yet, but at some point, you have a little bit of laxity in the neck area, and that will be taken care of with a neck lift or a facelift. But again, I stress doing these surgeries at the appropriate time, and that is a time where there's a big enough a problem to have a nice improvement, but while making sure that you still have good skin elasticity to give you some longevity in that. So I think that's we've got a good plan together, and and we can go ahead and talk at some point about the procedures and the recovery from those if you like.
Okay, fantastic.
Okay.
Thank you.
You bet.